Well, for nursing leaders and people who are responsible for advocating for resources and for managing resources for nursing, I think understanding the work and understanding that we can't go without a certain amount of resources, using complex adaptive systems theory to drive solutions would help them make better decisions than we've made in the past when we don't have the right number of resources. When I was a nursing manager and I didn't quite have the staffing that I thought we should have for the types of patients, the acuity of patients, and what was going on the unit in terms of activity, I would make sure we had the numbers, but I would leave a little uneasy, and my plan was hope. I hope everything turns out all right. And that was when we could have the right numbers, but maybe the patient acuity wasn't right. Or maybe the numbers were right, but we had 5 nurses and 2 of them were less than a year out. And one was pulled from a medical unit and I had an orthopedic unit. See what I mean? I think understanding complexity and what it takes to provide care in a complex adaptive system like a nursing setting or a unit with complex adaptive people would help us make better decisions about what is enough or what's not enough. In terms of resources, when you start to just look at the amount of information surrounding one patient, and you have a nurse taking care of, let's say the normal load is 5 patients on a med-surg unit. And I understand every setting's different, units can be different. And so let's just go with Aiken's research, which says 4 to 5 patients, and if you get above that per RN, you start getting into more complications and mortality rates. Okay, let's just use her research. If you have a unit where you take 5 patients normally, you have all of the information around the health statuses of those patients. You have all of the information that's changing around those patients, new labs, new information you pick up on the patients in terms of their responsiveness, new information you pick up from families, or changes in responses of families. You have often multiple physician services or multiple physicians, so you've got all the informations coming from and needing to go through physicians. And then I haven't even said yet all the other disciplines involved in that one patient's time. So let's say a nurse manages all that information around 5 people. Think about adding 1 more patient in the bank of all of that information they handle. It's huge. And I think what Aiken's work represented was what happens when nurses have to take on, we can't think of it anymore as, well, just 1 more patient. What they're having to take on is all of the information and the information management, which can be changing all the time in our acute care settings around that patient. That's what they're taking on, all of that information. So decisions start to look different about what do we do if we have a call-in than if it just seems they just take 1 more patient, you know. So they've got a few more meds to pass, a few more vital signs to take. Well, that changes if you start to understand the work and the complexity of the work and the complexity of patients, the complexity of the nurse, the complexity of the unit, and you start considering they're not managing another patient in some discrete linear tasks. What they're managing is the constantly changing information around one patient. So decisions to me then become, you don't start adding a patient to every nurse. Decisions become, how do we make it so in our organization we have an immediate response to a call-in or more patients than we thought we were going to have? What's our plan for an immediate response to getting another nurse? That's a decision that respects change, it respects constantly changing and dynamic conditions, and it plans for that. Whereas the decisions we used to make, not appreciating a complex adaptive system that healthcare is and individuals are and patients are, decisions that didn't wasn't any solution because we weren't coming from that complex adaptive system understanding. So for leaders, it's understanding complexity and coming up with solutions that address the complexity and fit with the complexity.